I really wish more people understood how their nervous system impacts their pelvic floor. Hi, Madeline Golick, pelvic health physiotherapist practicing out of Mississauga, Ontario, Canada. And this video, I'm creating this because I really want people to have a better understanding of how their nervous system impacts their pelvic floor. So when I think about the nervous system, I think about a stoplight system, okay? So green means everything's good to go. And when you're feeling like everything's good to go in life, you're kind of, you have some tone in your body. It's easy to move. It's easy to do things. You're like in the flow, and that impacts the way that your muscles move and function. When we go into a yellow light, so something stressful is occurring, the yellow light is like proceed with caution. And so when you think about proceeding with caution, it's kind of like, I'm a little apprehensive. I'm a little bit more tense because I feel unsure about the situation. So when we go into a stressful situation, oftentimes there's some level of uncertainty or something is like a little off. That creates tension in our body, and it also creates tension in our fascia. We have fascia and muscles in the pelvic floor. And if I feel like I'm feeling uncertain about this medical procedure, or I'm feeling uncertain about intimacy, or I'm feeling uncertain whether I'm going to be able to hold my bladder or find a washroom, that's going to create tension in the pelvic floor. And then we have the red light. And the red light is kind of like when we're super overwhelmed in life. And that kind of creates a shutdown in the body. Like you're just like, I got nothing left in my body, right? The body's just like, I'm done. Can't take anymore. And when the body goes into that phase, it tends to go a little more like flaccid, right? The muscles just kind of let go. Everything kind of gets sort of heavy. It's hard to move. Motivation is low. And that will also influence the muscles and the fascia, making them a little more tired, a little more loosey-goosey. And whether you're in the yellow light, whether you're in the green light, whether you're in the red light, that's going to impact what you experience symptomatically, right? In green light, you may not notice your symptoms as much. Yellow light, I'm noticing my symptoms are starting, but I'm not really sure what may have triggered it. Sometimes it's their nervous system. If I'm in the red light, right? I may notice other type of symptoms showing up. So sometimes I get clients to get really, really curious about how their nervous system may be impacting their pelvic floor symptoms. And so hopefully this gives you something that you can track.